So welcome everyone to Lessons from the Field. As you know, this is a series of interviews that we do with a diverse array of guests, all of whom have a common thread, and that is a passion for pharmacy and pharmaceutical sciences. Today, we're really happy to feature Candy Tsourounis, who is a PharmD graduate from the class of 1993. She's currently a professor of clinical pharmacy in the Medication Outcomes Center at the University of California, San Francisco School of Pharmacy, and drug utilization supervisor at UCSF Health. So Dr. Tsourounis, thank you so much for being with us today. It's great to see you and have you on. We're gonna be asking a few questions. These are questions that I'm sure will really benefit those listening to provide some insight into your career and your experience. So without further ado, let's go ahead and start. I guess if you could just, Candy, if you could just walk us through in a few minutes kind of your career from the time you left UIC, which I know is a little while ago.
Yeah, no problem. Thank you so much for having me. This is so exciting. I'm thrilled to be doing this. When I left U of I was very committed to being challenged. Really, I wanted to be in a new environment, having to learn new systems, navigate new relationships, learn new people, meet new people. And so for me, I think leaving was a challenge, but one that I really wanted. And so for me, that was going to a different state to practice. And I knew that I wanted to come to UCSF largely because of the two components that at the time were very similar to the University of Illinois program, which was a strong clinical program. I knew I wanted that, but I also wanted to focus on teaching. And I thought that the UCSF program at the time met those two requirements. And I ended up applying to the program. At the time, we called it our general pharmacy practice residency. Now we're calling them PGY1 residency experiences. And so I ended up matching at UCSF. And so I stayed there to complete my PGY1 residency. And then I applied for our PGY2 residency in drug information and literature evaluation. And I feel like those two years of residency really prepared me to be the practitioner that I am today.
Great, well, thank you for that little overview. I feel a little awkward asking this question because you're a drug information specialist, and the question is, how do you stay current and contemporary with your knowledge? And I know that obviously that's there's a lot of pieces to that. So why don't you go ahead?
Yeah, the biggest thing that I would sort of recommend to either current students or new practitioners, and certainly even pharmacists who are practicing, it's really about reading. In other words, staying up to date with what is happening in the world of pharmacy. And by that, I mean, certainly keeping up to date on new drug approvals, new drug developments, whether it be, it depends on where you are working or what your setting is. But in general, I feel that staying up to date with new drug approvals or new therapies or sort of the trends in pharmacy practice really help you stay up to date. And I always tell our students, it's great that you're in class and you have this expert who's coming to you to lecture on whatever fabulous topic it is, and they're telling you the most contemporary and up-to-date information. But when you're practicing on your own, you're not going to have that. And so, you'll have to find ways to stay up to date on your own. And part of that might be through journals, Part of that might be through getting email updates on the tables of contents of whatever journal is interested, is within your interest. But another important element is attending conferences. And while that might seem intuitive or somewhat a boring subject, I really feel that by attending conferences, not only do you stay up to date with things that are happening within the practice of pharmacy, but also you can network and learn about challenges that other people are facing that might be in your same situation, and learning about strategies and how they're addressing whatever it is that you're struggling with. And so I think reading, and going out there, meeting new people, attending, learning, sitting in conferences, listening to the current events that are happening is actually quite important. And I would also add, for our Gen Zers and the younger generation, I find that Twitter can be a very good place to stay current on developments. And we also have a term called medical Twitter or pharmacy Twitter, which is where you follow people who are obviously scientifically focused at the top of their field, who are tweeting information and new developments in real time. And I certainly saw this happening during the time of COVID, which was really helpful because you could really stay on top of what was happening. And by that, I mean following virologists, infectious diseases experts, epidemiologists, really timely information that kind of keeps you up to speed.
Yeah, well, that's very helpful. Sometimes we think of social media as just being a time sink, but certainly there's some very valuable insight we can gain from that. So thank you.
Absolutely.
Let's see. I kind of want to go back to your opening statement about you moved to San Francisco from Chicago, and one of the things I find with students is they're sometimes hesitant to branch out like that, but there's so much value to be gained by the new network and insights that you can gain from practice in a different place. Or if you'd mind just commenting a little bit more on that, because it's obviously served you well.
Yeah, I feel that maybe my preference is that I enjoy a challenge, and I enjoy being challenged in that way. And I know that not everyone has that same comfort level. But I have to say that being challenged is how we grow. Mm-hmm. And I say this because I've been challenged in many different settings, and I can share with you that early on in my career, I traveled a lot and I lectured a lot because my area of expertise was in the area of nutritional supplements, dietary supplements, herbs, etc. And this was at a time when not a lot was known. And in my travels, I was challenged in real time at these very large conferences. And I had to learn to obviously always be respectful to the comments, but to also be humble and to say, that's a good question. I don't know the answer to that, or maybe we just don't know the answer to that yet, but that is a question we should be asking, right? And so I feel that challenge that I would constantly get by others, whether it be medical professionals, pharmacists, consumers, family, that helped me practice how to respond to people on the spot. And it helped me think about how I had to contextualize all these competing questions and issues. And I took that and I also applied that to when I'm in a new environment and I have to learn about this new environment and who do I reach out to for this and how does this organization respond to these issues, right? And The other element that is critical is to listen and observe. And so I am very careful to always be observing, trying not to talk as much, but to listen and to appreciate how others interact and how they communicate, because then that helps inform me of how I can communicate with others. And so I think moving to a different environment allowed me to pay attention and to be more mindful and to observe how the culture of that organization, as each organization has a different culture.
Right. That's great insight. Thank you so much. Well, let's go on to the next question. So this is more about your career and just kind of where do you feel like you've had the most impact? Maybe just give us some examples, or and maybe as a way to illustrate for our students and others, what they might look forward to in the future.
You bet. Over the course of my career, I would say that there are two uniquely important areas of pharmacy that we as pharmacists can have a significant impact on. They're sort of related. And maybe some of the students were like, oh no, this topic, but this topic is pharmacokinetics. So I have found over the course of my career that a lot of our health professions colleagues, whether it be medicine, nursing, physical therapy, dentistry, whatever profession you might land on, they struggle with a lot of the concepts of pharmacokinetics. And we as pharmacists are uniquely positioned to help explain how medicines work based on these principles. And this is, I always tell our students that, we didn't just try and torture you by teaching you pharmacokinetics. There's a reason. And the reason is that you can apply those pharmacokinetic concepts to just about any question you might receive as a practicing pharmacist. And so I will always go back to, you are uniquely trained in understanding the absorption, the distribution, the metabolism, the excretion of medications, and understanding that interplay will help you be a better pharmacist. And I'll give an example with drug interactions. This is an area that many healthcare providers and consumers don't fully appreciate. And so I'm always finding myself in a position to help explain the differences between a single dose and multiple dose, and how those can affect drug interactions, or how we as a pharmacist are uniquely positioned to help patients with medication adherence issues. And this goes back to really listening to patients. And I've had a number of times where I've observed our students counseling patients, and I'll have to, through simulations, and I'll have to say, stop, okay, what did that person just say to you? We can't ignore what they just said. You can't let that go, because that's going to feed into some other unique element to their adherence. And so I think those elements have been so important, because they can impact not just the patients that we care for, but our friends and family members who we get lots of questions from about medications. So for me, I always tell our student learners that understanding pharmacokinetics, drug interactions, and really listening to patients are the three ways that you can have the most impact as a pharmacist. And I've seen that throughout my whole career.
Yeah, no, that's excellent. Very good. Very good. I identify with all of those. Thank you. So I guess moving on to, I know that over your career, you've had probably, a number of really important mentors, people that have given you advice, maybe some here at UIC, but certainly at UCSF. so on. So over that time, what maybe you could pass on to the next generation some of the really good advice that you've got.
You bet. There's one quote that has resonated with me for many years, and perhaps the audience has heard this quote before, but it really resonated with me, and I still think about it to this day. And that is, if you're the smartest person in the room, you're in the wrong room. And I can't say enough about that, because it goes back to the whole concept of challenging how we think and challenging our perspectives and our thoughts about certain issues. And for me, I appreciate learning from others and surrounding myself with people who are brilliant or have experiences that are very different than mine. Because again, this will all tie together. Listening and observing, you learn so much by how others incorporate information that's been shared, how they integrate that information, and then how they take that and then respond back. That's sort of the secret sauce of being an effective leader, and saying, you know, I used to have that thought, but I've changed my mind. The data and the science has now changed. I believe this other way now. And that's really what's at the heart of science, is it's constantly evolving, and we have to evolve with that. And so surround yourself with the right people.
Mm-hmm.
That'll make you a better pharmacist.
Yes, that's for sure. That's great. Okay, so then I think kind of along that same line, we wanted to ask, because we all have difficulty sometimes balancing our work life and our home life, or what we do outside of work, and how do we stay, you know, fresh or refreshed, energized, and so forth. So do you have any tips for those who might be listening on work-life balance, or how to balance?
Sure. One of the most important things is to establish appropriate boundaries for yourself. And, you know, my boundaries might be different than someone else's boundary, but for all of the people that I interact with, you know, a good example of this is to say, I may be responding to your email at midnight, but I don't expect you to respond to my email at midnight. That's a really clear boundary. Or when you take paid time off or vacation time, you might see my emails to you, but please don't feel obligated to read them. That's another boundary setting. And so I think setting realistic boundaries is a very, very critical step. But backing up and really thinking about a more broader sense of success, I would say show up, right? Half the battle is showing up. And for me, showing up means being engaged, going to that optional committee meeting or to that optional networking lunch. Being present, showing interest and engagement is really, really important, especially early on in your career, where you're trying to establish yourself and maybe establishing your role or where you want to be more engaged or more active. Showing up is so important. And I always tell our students who sometimes find themselves in challenging situations when they're on their learning experiences, I'll say, show up early, arrive early, and stay late. That's how you show commitment. That's how people form a perception of you. And so those two things I think are important. And then lastly, learning from your mistakes. You know, we always say, you know, you have to learn from your failures and we have to normalize failing. But when you're in that failing role, it's horrible. It feels terrible. And so for me, I always reflect back after the moment, like, oh, that didn't go very well. How did I mess that up, right? But within that reflection is, why did that not go well? Why did that meeting not go well? Why was I not successful in that endeavor? What could I have done differently? And how will I take that lesson and apply it in the future scenario? And that is sometimes an uncomfortable thing to examine in that quiet space, in your quiet time after it's happened. But I feel that that is a very important stepwise approach that can help you become a better pharmacist and a better leader eventually.
Wow, that's great advice. All of those are really good. I really like, setting boundaries for yourself, but what you said was setting boundaries also kind of for other people, because you're giving them permission. You're saying, don't respond to this, or you don't need to respond to this. That's really good. And I so agree with the showing up part. You can't get anywhere if you don't show up. That's like, step one. And if you don't do step one, you can't get to step two. There's no way.
That's right. That's right.
Thank you for those. So what about for folks that are earlier in their career, maybe even our students or your students, what do you tell them? They're still trying to figure out what pharmacy is. It's such a, the pharmacy program is so short, and for them to figure out what do they want to do, as in a career, and how do they prepare for that while they're in school? There's so many pressures on them. Do you have any advice for either students or those who have just, who are just starting out?
Absolutely. I will say that across the board, the number one area of anxiety amongst not just recent grads who are looking for a job, or for residents who are looking for their next step, the number one concern is, they have this idea that first job or that first role straight out of residency has to be the ideal job. And I always have to say, stop right there. You will find the opportunity that is right for you right now. That means that it could be completely different 5 years from now, 10 years from now. In fact, I'm sure of it, that it will be different 10 years from now. And there's this sort of expectation that you have to find the perfectly suited position. Importantly, I see this when residents have completed their second year, so an emphasis in whatever thematic area, whether it be oncology, pediatrics, emergency medicine, critical care, et cetera, that they have to have a position that specializes in that area. And I have to say, that is nonsense. You've done that work. You are prepared to take on that role, but that doesn't mean you have to, or that you should right now. And if you look at many of our clinicians, where they started and where they're at today can be in a completely different therapeutic field, or it could be in a completely different practice area. And so let go of that idea that first job has to be perfectly aligned. Find the job that is right for you right now. And that means maybe it's right for you and your family. It might be right for you and your immediate family, your parents, your financial situation. Don't feel like it has to be ideal. The second lesson I would say is that I always tell our students this. I show them a list of characteristics that have something to do with, critical thinking, problem solving, communication skills. And I ask them, just an example of some of the lists. And I ask them, what do you think this list is getting at. What is this list? What speaks to you about this list? And many of them say, oh, these are all skills that we need. Yes, yes, yes. They're important for our success, and certainly they are. But what that list is, it's a list of highly desirable characteristics among all of the Fortune 500 companies. And that means that while, you as a student right now might be thinking to yourself, I need to memorize these facts, I need to pass these exams, I need to get straight A's, or I need to get whatever it is to achieve some level of success. What companies are looking for are not your innate ability to memorize facts and regurgitate them. We can all look that up. We can all go to our drug information resource and, our peripheral brain, our phones, and look up information. We're not looking for you to memorize facts. Neither are these companies. The people that are hiring you are looking for your ability to reflect on things that didn't go well and improve, right? Your ability to accept constructive feedback. They're looking at your leadership ability. They're looking at how you interact with others. Are you a supportive employee, or are you difficult to work with? Do you arrive on time? Are you consistently late? Do you meet deadlines, or are you consistently late? So where you see what I'm trying to say here is, we all, when you finish school and when you finish residency, you will have the knowledge, skills, and abilities to be a successful pharmacist. But what will stand out, what will make you even more successful, is these leadership characteristics and your ability to interact with others. That's what will set you apart. And that should be something that you should be thinking about going forward as you're thinking about your career in pharmacy. And so remember those things. And I feel like it all goes back to your ability to reflect. Mm-hmm. And as a student and as a resident, you get feedback from your preceptors all the time, and they're giving you evaluations. But take a moment to think about what feedback you've received, and think about it within the broader context of who you are as a person, and think about ways in which you can act on that feedback, act on ways to improve that, because that's what's going to make you a successful employee and a successful pharmacy leader.
Yes. Wow. I like how you weave all these things together. It's fantastic and great advice. So over your career, what has influenced you or kind of brought you to where you are now? What were the kind of major experiences or events that shaped you and what you're doing?
Yeah. This is a really good question. I have to say that preparing for presentations, executing and delivering these presentations, and it kind of goes back to what I had said before, which is being challenged, and not in an aggressive way. Not that they're challenging me, it's more challenging my ideas. Being challenged in ideas has really led me to become a better pharmacist and even a better person, because it forces me to rethink my ideas and my understanding. It's sort of like when I went back and said, over time, your ideas may change. And certainly I've seen this when I was a resident. What I knew about managing acute MI was very different than what we know today. As the science has evolved, so too as our thinking and our appreciation for that. And so for me, lecturing to large audiences, preparing to give a presentation, and having people ask me questions and challenging my ideas is what's led me to where I am today. I've also had the opportunity to do a lot of media interviews, and that's a whole other challenge in and of itself. But that too has allowed me to be better prepared and to be able to think on the spot and be able to respond to questions that might be not so friendly or may have a particular reason that they were asked, right? And so I feel like that has helped me go through an iterative process of my thoughts and my ideas in whatever it is that I'm saying. And it's also taught me to be humble. And I think that's a really important thing to remember, is that we can't know it all. And all we are doing is presenting on what we know. But at the same time, I tell our students and our residents who are presenting, who feel like, oh my gosh, I don't know enough. All my preceptors are going to be there listening to me. And I say to them, hold up, you know this information better than anyone does because you've researched it. You've spent all this time learning about it. You know the intricacies better than anyone in that audience. Sure, the people in the audience might be experts in the subject, the medical subject, but you know your data. You know what you did. No one else had access to that. So that's another way to be empowered. And I use that when I'm preparing for a lecture. I use that when I'm preparing for a media interview, is that I am uniquely knowledgeable about that subject, that content. So
I like that. So in a way, you're saying that you've put yourself in situations where you're uncomfortable, but then also remind yourself that you do know the material, and you make sure that you're prepared, and then you are successful and you've grown from that. So
absolutely.
Yeah. So kind of coming full circle here then to the very first question, and kind of what you did since you left UIC. Maybe you could say a little bit about your time here as a student. I would guess that also was something that influenced you a little bit, at least as you started off on your career.
You bet. There's not a day that goes by that I don't think about all the wonderful instructors and the amazing learning that I was afforded at UIC. I am so proud to be a part of the program. I remember the style of learning that UIC had used and how successful it had made me, because I felt like I had a really good understanding of the subject matter because of how it was delivered, how the content was delivered. And I also appreciated the clinical experts that were asked to present that content. And I felt that I could ask them anything. And I knew that I was getting the most current and up-to-date material. And so for those reasons, I was so impressed. Now looking back, I can see how wonderful an opportunity that was. And I'm glad that I showed up every day. How about that, right?
Yeah,
because you don't get that. And I tell our students, I'm like, you're not in class, you're missing out on the subject matter experts who do this every day. Like, show up.
Oh my gosh, I hope I can quote you on that.
Oh, absolutely.
Okay, good.
They just don't know how valuable it is until it's not there. And then you have to go searching for what's the current standard of practice for this theme.
Yeah. Well, Candy, thank you so much. This was a lot of fun and great advice, full of it, great advice here. And again, how you kind of weaved it all together through your career, but in terms of, just offering folks examples and ways to think about how to self-assess and how to put yourself into situations that you grow from, and so forth. So it's been fabulous. Thank you so much.
Thank you. It's been a pleasure. And, you know, if I had to use one word to describe, you know, what UIC pharmacy has meant to me, it would be opportunity. It has given me
Awesome.
the opportunity to do so many different and amazing things. And I'm eternally grateful.
Oh, well, thank you. I don't know if you know this or not, but there are billboards all over Chicago that say opportunity, and the O in opportunity is a UIC, you know, the UIC circle.
I love that. I had
Yes.
no idea. Oh,
Yeah.
see,
Wow.
it's perfect. It's the truth.
Yes. Great minds. Well, thank you again, Candy. I'm
You
sure
bet.
that, you know, our students and others listening to this are going to get a lot out of it. I look forward, maybe next time you're in Chicago, you can stop by and visit the college.
I
Maybe still have
absolutely
family.
will do that.
Good.
Yes.